Good evening, everyone, and thank you for joining us. Bryan Health unveiled new technology they're using with patients who recently suffered from a stroke or a brain or spine injury.
The computerized walking frame is meant to increase safety while patients relearn how to walk. Channel 8's Jessica Blum joins us now with more on this very interesting topic. Jessica?
Yeah, the exoskeleton is meant to support your body weight, continuously monitoring the body's position to encourage a normal walking pattern. Settings can be adjusted depending on the need, picking up or backing off to allow more control in the process. One Lincoln man reflects on how far he is today following the use of this technology just a year ago. Shortly after his dad's passing and finding a home for his mom, 52-year-old Brian Carlson was in the process of moving out to the family farm with his 5 children last year during the holidays. It was during this time that he was diagnosed with COVID-19 that later manifested into a severe muscle weakness. He spent time in the intensive care unit at Bryan Health, relying on a ventilator to breathe and laying completely paralyzed.
I couldn't really lift my arms to feed myself. I couldn't get out of bed. I couldn't move my legs. I couldn't raise or I couldn't flex my toes. So they suggested this exoskeleton, something new that the hospital had been donated by the Eagles Club.
He developed a rare neurological complication that alters the immune system to attack muscles and nerves. Carlson was one of the first patients to use a newer technology donated to Bryan Health by the Fraternal Order of Eagles. It was with the help of this computerized walking frame that he regained strength enough to return to normal life with his kids and as a preschool teacher.
I think once I tried it out and I realized that wasn't so bad, and then they say, okay, we're going to set a goal for how many steps we'd try to do the next day, or hey, do you think you can make it to the end of the hall? Then I knew I was going to probably be able to get out of the hospital.
Carlson was in the hospital for 6 weeks from Thanksgiving up until about New Year's. But this year, Brian will be spending Christmas rocking around the Christmas tree with the whole family again. On Tuesday at Bryan Health's showcase of the technology, the organization and the physical therapist shared how much it means to see donations changing people's lives.
The patients really can benefit from it. It can give patients so much more confidence and allow them to feel what it is like to be up and normal when, from a physical perspective, they're not able to do that, or it takes so many hands to get them to do that. It just allows that to happen much easier and quicker.
Only 4 physical therapists are currently trained with the exoskeleton, but they have assisted over 40 patients in the last year in nerve and muscle recovery. And the Fraternal Order of Eagles is always accepting donations, and local donations have helped Nebraska to be the only state with 3 of these devices. Currently, there are only 6 that are in use around the country with the hopes of helping more patients on their road to recovery.
Very cool. All right. Thank you for bringing that story to us, Jessica.